Hello and welcome. You're inside this Sunday's edition of Jamaica Magazine. I'm your host, Audrey Williams. Don't go anywhere. We'll be right back.
As a nurse, my heart bleed for see the accident victims. Worse when blood and oxygen short. Ease the burden on our hospitals, no man. Please, me I beg you no. Drive safe on the road.
On Get the Facts this week, the focus is on substance abuse among teenagers. Watch as we explain more.
Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm Theodore Henry. Today's discussion will focus on the use of new psychoactive substances among teenagers and the influence, exposure, and accessibility to these and other substances. The May 2022 Rapid Situation Assessment on Substance Use and Urgent Issues in Secondary Schools has shown a shift in the consumption habits of teen users. And we break down the findings with Uki Atkinson, Research Analyst at the National Council on Drug Abuse, NCDA. Welcome to the program, Ms. Atkinson.
Thank you for having me.
All right, let's get the facts. What was it that prompted this study? And if I can go by my notes, 13 parishes, 160 students. What prompted this study?
Okay, so following the return to in-person school, the NCDA received a number of calls from schools across the island. Referrals, requests for interventions, there were increases in confiscation of drug paraphernalia, and then the St. Catherine South Police Division came out with an article basically red flagging the fact that students were engaging in pill parties, that edible use was on the increase in St. Catherine schools, and therefore the NCDA thought it necessary to conduct this rapid assessment. One of the things we want to highlight is the fact that it's not a prevalence survey.
Right.
So when we talk about the shift in consumption levels, we don't necessarily know the current level of consumption. What we did was qualitative in nature. We went to 13 high schools, conducted focus group discussions, as well as interviews among guidance counselors.
Okay. You know, when I saw the shift, I was curious if it's a thing that we're seeing increased consumption, as in compared to numbers prior to COVID.
Right. So it's not about numbers right now because we have not done a survey.
Okay.
Surveys is where you get things like prevalence and, you're able to tell the scope of the problem.
Actual quantity.
Right.
Okay.
No, right. So that's quantitative.
Right.
But this is exploratory in nature to determine what's happening among our students now. What are the substances in their perspectives that are considered to be more popular among them? What are the issues that adolescents are facing now in their perspective, as well as from the guidance counselors?
All right, let's talk about that study and some of the information you got from it, because now I am very curious. So what are some of the key findings? So
a variety of things were disclosed in terms of the issues that adolescents are now facing.
Right.
These ranged, in addition to drug use, there were issues raised about mental health circumstances, the fact that more of our adolescents are exhibiting anxiety and depression and suicidal ideation. The issue to do with physical and verbal aggression, which we are seeing almost weekly in the news.
Amongst peers or?
Among peers, among students in schools. There were guidance counselors who outlined the fact that conflict just out of thin air, escalates. Everybody's on edge kind of thing.
Okay.
The issue of inappropriate social media use, the access to inappropriate content, the issue of poor parenting environment, so the home environment, parental supervision and participation has waned, issues to do with the inability to settle and focus on schoolwork. So there's a wide range. And then, of course, there's the issue of increased substance use, or the perspective that substance use among students has increased.
Did any of the students make any remarks in terms of accessibility?
Absolutely. So Well, first of all, we asked what are the more popular substances, and the three most popular things that came out were Molly, vaping, and edible use. And we explored those further. And for all of those substances, students were able to tell us that they can, get them on the street corner. There were students who were selling it.
Right.
There were people who had it on their WhatsApp status. They could walk into some facilities to buy vape devices.
So this is known.
And we want to also express the fact that it was across the island. So it's not as though some of these things were confined to a particular type of school or a particular area of the island.
Right.
It is something that across the island they expressed.
I see. I'm also curious, based on the study, you mentioned the stressors and the issues in terms of social conflict. Was there a portion of it that spoke to just purely the recreational aspect of it?
You mean just to take it to have fun?
Right.
And absolutely. And that will always be a reality. All across the world, adolescents experiment with substances because of that pull factor that, is something cool, their peers influence them. And so that is something that is not new. That is something that has been with us and will continue to be with us,
What's the impact of these psychoactive substances on teens?
Okay, so when an adolescent uses a substance, there is a significant risk. First of all, the earlier it is used, is the more likely that problems can develop later on. So our brains are not fully developed until we're in our mid-20s.
Okay.
When substances are introduced to the brain at an early stage.
And sorry, if I can just chip in here. Substances, we've said psychoactive. That
Right. So we're talking about So we're talking about alcohol, which is a depressant. We're talking about cannabis, ganja. We're talking about nicotine. We're talking about MDMA now, which is Molly.
Right.
These things can interrupt the way that the brain develops, especially if a young person goes beyond experimentation and starts habitually using these substances.
Because many of them are addictive.
And absolutely, absolutely they are. And what our studies have shown is that 1 in 5 adolescents who use a substance, this is Jamaican studies now,
Yes.
1 in 5 is at risk for becoming dependent on it later on.
1 in 5.
So 1 in 5. And so we really want to be able to have people understand that when you introduce your child to a substance at an early age, you really are not helping them, you are potentially harming them.
So the impact is pretty serious.
Yes.
Especially in the teen demographic.
Right. And what it beyond the brain development issue, it can impact their behavioral patterns, so they can become more aggressive, they can, their academic achievement can be impacted, things like risky behaviors, so they can engage in risky sexual practices. Since we have come out with the results from this rapid assessment, a number of calls have come into the council about people being unknowingly drugged with the Molly, with using Molly.
Unknowingly?
So they're slipping unknowingly. And I'm talking about teenagers, I'm talking about young adults. So this is something that they're sexually assaulted and they only find out the following day. People have told us about videos that people have taken of them that they have no recollection of what they did, pictures taken or people telling them, or even having physiological signs, physical signs that something, occurred with them that they cannot recall.
Wow. All right, we are getting the facts about the impact of the new psychoactive substance on teen users. Don't go anywhere. We continue the conversation with Ms. Atkinson on the other side of this break. Welcome back to Get the Facts. We were discussing the findings of the May 2022 Rapid Situation Assessment on substance use and urgent issues in secondary schools, and we're going to continue that conversation with our guest, Ms. Uki Atkinson, research analyst at the National Council on Drug Abuse. Ms. Atkinson, you have said some very concerning things thus far, but let's keep going. Who is this study being shared with?
So this study is being shared widely. We have shared it with, first of all, our parent ministry, which is the Ministry of Health and Wellness, with the officials from the Ministry of Education, the National Security Council. We have shared it with faith-based organizations, with civil society, with academia. It's broad and wide because this is an emerging situation that all partners need to be on board in terms of the awareness as well as the articulation of strategies to be able to address the situation.
Are the parents getting in on this?
Yes. And there is a public education program which is about to be rolled out nationally. And one of the things that we're grateful about is that this public education is not just a one-shot, one-off, 3 months and then we're out. It's something that's expected to be sustained over time. Which is what is needed for public education.
Definitely. Compound interest builds things.
Exactly.
Yes. What other steps what other intended actions?
Okay, so as we said before, this was qualitative in nature. So we want to be able to look and see what is literally happening across the island in terms of the prevalence and practices and patterns of substance use. So there is a national drug prevalence survey about to be rolled out early next year. The last one we did was in 2016, and this is representative at both the parish and national levels. So we will, after that, be able to say what's happening among our population ages 12 to 65 years old. The last one showed that alcohol, tobacco, and cannabis were the main substances being used. But now we can look post-COVID, what is the circumstance? Because we do know that COVID did have an impact on substance use as well.
Oh, definitely. When you mentioned the feelings of anxiety, I just thought COVID.
Absolutely, yes.
There was that there. So what level of support does the NCDA provide? Is it on-the-ground sort of support or policy support?
There is a wide range. So the NCDA, we have a number of programs, prevention programs, drug prevention programs in the communities, in the schools, and at the family level. We also are part of the drug treatment court system, part of the diversion response plan, and we also conduct capacity building, not only in the health sector, but also in the education sector, so that people are better able to determine what are the signs of substance use. How do I screen somebody using a simple tool to be able to determine, okay, do you use? How much do you use? How frequently do you use? And based on the answers, there can be a brief conversation that you have with people to help them have more insight on their pattern of use, as well as refer them, if necessary, to more specialized services.
Does the NCDA provide material, for example?
Absolutely. We do have printed material that we issue in communities, schools, exhibitions, health fairs. We do a lot of that as well.
So a guidance counselor, a principal, even a concerned community-oriented parent can get in touch with the NCDA?
Absolutely. And in fact, in 2020 during COVID-19, or just as it hit, we conducted a number of capacity building sessions among guidance counselors, HFLE teachers, and deans of discipline. 443 were trained in that same screening thing. And we're actually about to do refresher training right now because it is also, it's still always relevant.
Yeah, that's great. As you mentioned, the public education has to keep happening.
Absolutely.
I assume the training has to keep happening because the substances, we're seeing diversity.
Yes, and they're becoming more and more elaborate and more easy for you to mask. So there are students who spoke about vaping in a classroom because the teacher can smell the vape, the products. It doesn't give off the same smell as traditional cigarettes, right? And so, yes, there is need for us to be more vigilant, for us to be more aware, and then not only that, but to know how to deal with it when it transpires.
I see. Ms. Atkinson, there are parents, there are teachers, there are even many of the students who are watching this program now. I want you to take a few seconds and just give them your final word.
So we want to say to Jamaica, adults, young, old, the fact that there are new patterns of use of substances in our midst, we want you to be vigilant. Young people, we want to say be careful of the company that you keep, be careful of the things that you are willingly experimenting with, because pleasure for a moment can impact your entire lifetime. And certainly for parents, we want to say be more responsible. You have to be participating in your child's life. You have to be supervising your child for you to be able to protect them from some of these dangers that are out there. Thank you.
Absolutely. Protection is the key word. And for more information, you may contact the National Council on Drug Abuse at 876-926-9002 or ncda.org.jm. That's the website. I'll do that again. It's 876-926-9002 or ncda.org.jm. This has been Get the Facts. Our guest has been research analyst at the National Council on Drug Abuse, Uki Atkinson. Thank you for watching, and until next time, I'm Theodore Henry. Take good care.
Jamaicans, look on the murder rate. You think that normal? We need to get every illegal gun and save our country.
A hidden, silent epidemic faced by most women, many of whom are unaware that they're suffering from this condition. In this next feature, we bring you all you need to know about uterine fibroids.
In a highly desirable world, hinging on some utopic idea, women would probably have been able to bridge the gender wage gap in workplaces.
Maybe our external appearance wouldn't be so important, and perhaps some medical conditions wouldn't have been so prejudiced against us.
But life cannot just be layers of what we conjure in our imaginations. It isn't always a working woman's Shangri-La, or our wives, mothers, sisters, or aunts' health ambitions.
In fact, there are certain health issues that affect women exclusively. Issues such as menopause, postpartum depression, uterine fibroids, and miscarriage. But understanding women's health concerns is the first step towards taking control of our own well-being.
Uterine fibroids are benign tumors of the uterus. That's in medical terms. In layman terms, they are masses that grow on the uterus or on the womb of a woman, and they can grow to various sizes. You can have one, you can have multiple. And the most important thing patients tend to ask is, are these cancerous? So benign means it's not cancerous.
Medical experts will tell you that the root causes may not be so clear, but there are certain factors that are most likely to account for this issue impacting women.
We believe a lot of women who have it actually do because of genetics. So if your mother or your sister or you have a strong family history of uterine fibroids, it's quite likely that you're at risk of having uterine fibroids as well. We also believe that they tend to pop up more so when your hormones are very active. So that's why it presents in those patients in their reproductive age. So once you get to your 20s, 30s, 40s, that's when you would expect fibroids to start to show up. It may be occurring in response to your diet. So if you have a poor diet, high in red meat, highly processed foods, very little fruits and vegetables, we believe that that impacts on the presence of fibroids and definitely the growth of fibroids.
Meet Raquel Bailey, whose unfortunate journey with uterine fibroids lasted for almost 9 years.
I was around 27 touching 28, and I went for my regular female checkup. When they did the ultrasound, they said everything was fine, but there was a point that he could not see beyond. So he decided to go do it vaginally. And that's when he found the fibroid on top of my uterus. I was saying to myself, it's hard. I'm not sure if I can get pregnant with it. I was worried about conception, of course, and I was worried about if it is cancerous or anything, because at that point I wasn't sure what fibroids was. I knew it ran in my family, but back then they didn't call it fibroids. My tummy began to grow, especially the top part, since it was resting on top, so my tummy began to protrude. And of course, when I had my period, the pain was severe. I had, to the point that I even had to lie on the floor to get a little bit of relief from it. Yeah, my clothes couldn't fit much because of the tummy hanging over.
The symptoms occur dependent on the size of the fibroids, the location of the fibroids, and also dependent on what else is happening to the patient otherwise, right? So common symptoms related to size are, if the fibroids are very big, then the woman looks as if she looks pregnant. So she notices that her tummy is growing, the waist of the clothes start to fit her a bit differently. She might start to have what we call compressive symptoms. Based on the location of the uterus, it can press on the bladder, which is in the front, and that's where your urine is. So you might find that you're complaining of more frequent urination. You're going to the bathroom to pee all the time, right? Another thing is that your bowel is at the back, behind your uterus, so you may get constipated. Again, because your nerves come from behind, from the spine backwards, then you can also have compressive symptoms on nerves around there, and some patients come with back pain. Because it is close to where the blood vessels go down into our legs and the nerves go down into our legs, some people complain about pain radiating all the way down to their legs, as well as swelling. If the fibroids are on the inner side of the uterus or within the muscle of the uterus, that's where your period comes from now. So those patients tend to complain about heavy bleeding. Bleeding that is lasting more than a week, more than the average period. They're soaking through pads in an hour, in 2 hours, messing up themselves, right? That causes a lot of social embarrassment. Not only that, but if you're bleeding that heavily, then you start to get symptoms of anemia. So you start to feel weak, dizzy, you might actually faint. Another symptom that patients can present with is pain. So if the fibroids grow to a certain size, then they start to outgrow the blood supply that comes from outer to inner. And sometimes they can, what we call, degenerate, and that causes patients to have a lot of pain.
I got married, and my husband and I spoke, and I said to him, all right, I don't want to do the surgery, have any surgical procedure done on me, just in case that they found more and they had to take out the entire thing. So I wanted to try and conceive before doing the myomectomy. Then I got pregnant in the February of 2021. That's when the fibroids became aggressive. It grew and it grew and it grew. I looked so much like I was full-term pregnancy when I was only 4 months pregnant. So it was very aggressive. I was really sick in the first part of the pregnancy. So much so that I was labeled a high-risk patient. After having my baby, I went to the doctor to do my regular checkup. And Dr. Madam was saying to us when we decide to take out the fibroids. So I told her we were waiting on her. She said, no man, the decision is yours. So I said to her, all right, maybe we can do it now. I was there touching my tummy. Because when I went in, it was huge, huge. It was like a full baby. It was the size, the fibroid was the size of a basketball. It was, yeah, and there were 3 others. So it was 4 fibroids. And she took it out, and when she took it out, she said everything went well, and my uterus, it's healthy. That's the word she used. The best part of my journey having fibroids is hearing that there are treatment options available.
So fibroids can be treated in a number of different ways, but really and truly treatment should be aimed at the patient's symptoms as well as what their future fertility desires are. Now, if you are having bleeding problems and the size of the fibroid is not significant, then we can entertain giving you medical management to try and maintain the bleeding to a level that is acceptable. So sometimes that involves using tablets. There are some NSAIDs that we use for that. There are hormonal tablets that we can use. There's also the hormonal injection that we can use to help to reduce the amount of bleeding that you are having. If it is that you are having a problem with pain and size, then that's where surgery comes in. A lot of the patients ask, "Boy, doc, I don't really want to do surgery. I'm not ready to do surgery." And they ask if there's anything that can be used to shrink the fibroids. There are medications out there that have been used to shrink fibroids, but they don't maintain the fibroid at that size for the rest of your life. And they can only be used for a short period. If they are not so large but they are plentiful and they're causing you significant symptoms like your blood count is really low, you're frequently missing work, it really interrupts with your daily living, then we would recommend doing surgery. And surgery involves either removing the fibroids only, or we can remove the uterus in total. Now that decision is a big decision. If you have finished having your children, you don't want to have any more kids, then clearly removing your uterus is okay.
What I learned coming out of this entire experience is that I should not be afraid of my doctor, all right, or doctors in general. The gynecologists, they are there to help you. Visit them, have an annual or your regular routine checkup. It is to ensure that you have a healthy life.
In Jamaica to get caught in debates that don't pay enough attention to the facts of the situation, to the realities of the situation. Technology changes everything. And as we progress and as we develop technology, it is the nations that develop technology, but more importantly, the nations that own technology, that own the future. For me, this is a big thing, to stand on the grounds of a former sugar plantation and say, we are going to build a technology school to produce the people of Jamaica who will not just be consumers of technology, but will become producers of technology, because that is the true liberation of our people.
That's all the time we have left today on this show. Join us tomorrow on this same station for another exciting installment of Jamaica Magazine. To re-watch today's offering or other content like this, visit our website, jis.gov.jm. From all of us here at the JIS, have yourself a wonderful Sunday. I'm Audrey Williams. See you next time.
This has been a production of the Jamaica Information Service, the voice of Jamaica.